Hi, I'm Dr. Carolyn Go for Purus. In this video, we're going to talk about how to use essential oils. Essential oils can be used in a variety of ways, from inhalation to topical application, as well as being used internally. Now, if you have a look at the bottle of your essential oil, it should have a recommended usage on it. For this lavender essential oil, it says it's good for diffusion as well as topical application. Now, the amazing thing about essential oils is it's not a one-size-fits-all, and you can tailor it to whatever you want or whatever you need. And this is a great way to practice because you can really mix up blends and really make it yours. Inhalation is one of the most popular ways of using essential oils. After all, there's a reason why these oils smell so good. Under the umbrella of inhalation, you have direct inhalation, indirect inhalation, diffusion, as well as steaming. With direct inhalation, what you're doing is basically unscrewing the cap of the bottle and taking a nice sniff of the essential oil. Now, this is my chosen method to choosing an essential oil for myself or for my clients or patients. So unscrewing the cap of the bottle, keep the bottle about an arm distance away from you. You don't want it really too close or right under your nose because the vapors can be quite intense and your nose can be quite sensitive, or your eyes could be quite sensitive to it. So for me, I just bring it very closely towards me, and just about here I can get this lovely lavender scent. And that's about just enough for me. Now, if you have patch tested this oil and you don't have any allergies to it, what you can also do is put a drop of it directly into the palm of your hand, like so. Rub your palms together and bring it up to your nose and inhale this beautiful lavender scent. With indirect inhalation, you basically use an object, put a couple of drops of essential oil on it, and use that to create a very slow, sustained release of diffusion into the room or space that you're in. So I have this cute little owl which is sitting on top of a wooden peg, and what I like to do is put a couple of drops of essential oil directly on him. I then peg him onto the vents of my aircon in the car, and as it's turned on, the air conditioner goes past him and infuses the air with beautiful, lovely scent. Diffusion is one of the most common methods of using essential oils, and I'm sure we've all seen these lovely looking diffusers before, and what they are basically high-tech steamers. So how to use them? We take the lid off and we fill them up with water till the watermark line. We put a couple of drops of essential oil in them, so about 3 to 5 drops is normally recommended. We then put the cover back on them, turn them on, and it starts to steam and diffuse the room with some lovely scented essential oils. Now, most diffusers also come with timers on them. For me personally, I don't usually have them on for longer than an hour, unless it's a massive room and I really need to diffuse a lot. An hour I feel is enough for me to get the benefits of the oils. If you're suffering from a cold or a flu or have any sinus infections or any blocked nasal passageways, then steaming is a great way to unblock these passageways. So just grab a bowl of steaming water. A drop of essential oil is all that's needed really, and I love to use eucalyptus for this. And just place yourself not too close because, you know, if you've got sensitive skin, then steam really would aggravate the sensitive skin. Grab a towel, place it over your head, and just inhale the beautiful vapors. And it works like magic to unblock sinuses. For topical applications of essential oils, the oils are placed directly onto the skin. When the oil sits onto the skin, it's absorbed very quickly through the skin. It penetrates into the surrounding muscles and tissue area. The oils then penetrate directly into the bloodstream and the lymphatic system. From here, they go into whatever targeted organ is necessary, and once the work is done, they're then expelled via the lungs, through urine via the kidney, and through the skin via sweat. When applying essential oils to the skin topically, it's very important to ensure that essential oils are diluted beforehand. There are very few essential oils that can be used neat on the skin, and a good quality lavender essential oil can be used neat. When you're diluting oils, you would normally choose a carrier oil to dilute it with, and there are lots of different kinds of carrier oil. There is jojoba oil, coconut oil, sweet almond oil, moringa oil, many different kinds. The way I choose my carrier oil depends on where I'm going to be using this dilution or this blend. So for example, when I use a blend for the face, I tend to go for jojoba oil. because the comedogenic index of jojoba oil suits my skin much better than something which has a higher comedogenic index, which is more likely to block your pores. So for example, moringa oil, I love moringa oil. It's full of vitamins and minerals, but because it has a high comedogenic index of about 4, I normally wouldn't use it on my face, but I would use it on my neck area and probably anywhere else on my body. Right, so let's go ahead and dilute some essential oils. Here I've got the beautiful frankincense, which is brilliant for rejuvenating and anti-aging properties, great for the immune system as well. And I've got an empty bottle here, which is roughly 280 drops, so that's 15 milliliters. Right, so what we're going to do is we're going to create a blend using the frankincense and a coconut carrier oil, and we're going to create a 2% dilution. So we would put in 5 drops and we would pour the carrier oil into this empty bottle up to roughly just about where it starts to neck. We then shake it up to make sure that it's nice, well and truly mixed. Okay, so this is about a 2% dilution, and you can use this on quite large areas of the body. Now, if you're going to use something very specific on a very small part of your body, you can increase the dilution rate, and in fact, you can go up to 40%. So now that you've gone ahead and diluted your essential oils, where should you use them? Where's the best place to use them on your body? Well, it really depends on what you're using it for. For example, if you've created something for pain relief, you've got an ache or pain somewhere, and maybe I have a neck pain, I would then put it directly on my neck or the aching muscle or wherever it hurts. However, if you just wish to use it on your body, you can use it on your pulse points. So for example, on your wrist, just behind your ear, along the jawline over there, and also on your ankle. You can also use it on the base of your feet. It's a very good absorption surface, and in fact in Ayurvedic medicine they use a lot of oils and medicines for the absorption to be very quick into the body from the base of the foot. In my practice, I like to use essential oils in combination with acupressure points. So for example, if someone comes in and she's suffering from insomnia, she can't sleep, then I like to use maybe a blend of something that fits her constitution, her body type, as well as her illness. And I would then use it on the appropriate acupressure point, which in most cases for insomnia, the spirit gate acupressure point works really well. So I would apply the oil directly on that acupressure point, her specific blend or her mix, and keep it there for about 30 seconds. And I would also give her that oil to take home with her so she can use it daily. Now we come to the use of using essential oils internally. Really, the jury is still out there when it comes to ingesting essential oils. There are certain schools of thought that say ingesting essential oils is absolutely no problem at all, and other schools of thought that say it's an absolute no-no. Personally, I don't feel we need to ingest essential oils because we can gain the benefits from just inhalation as well as topical application. I do, however, use it in my cooking. So for example, if I'm baking a lovely tray of lemon muffins or lavender muffins, I put a drop of essential oil into the batter and it smells beautiful. I also use thyme, oregano and rosemary for marinades and pasta sauces, and it works really well. It's also very cost effective. However, if you do feel that you want to ingest essential oils, then remember that essential oils in nature are hydrophobic, which means they don't mix well with water. So if you are going to take them, mix them with a carrier oil, for example, coconut oil or honey, or go for the hydrolipids, which are already emulsified essential oils.